Yes, so we've had a really good session this morning. We had diseases covered in the top red cell abstracts were PNH, thalassemia, as well as sickle cell disease. So there were two really interesting studies that we discussed that was presented in the PNH disease group. One was a very large study from the International PNH Registry, which essentially looked at survival in patients who were treated with C5 inhibition, so treated with Eculizumab essentially, and there was data from about over 4,500 patients. It's quite impressive, long-term sort of follow-up data. And what it did show was that the patients who received Eculizumab appeared to be living for longer. There was better survival in patients receiving treatment, even though they had the higher disease burden, if you like. But the group of patients who were on the untreated arm, people who were higher disease burden, obviously didn't survive as long. Now, obviously that brings up the thing that interests me the most, which is health inequalities. And it just seemed that there are many parts of the world where Eculizumab treatment is not available because of cost and access to treatment. And it clearly shows that there is that difference. But for people who are able to receive Eculizumab in countries where it is available, such as in the UK, there seems to be clearly a survival advantage of Eculizumab. So that's really interesting information gleaned from that study. The next PNH study was to do with a more new generation complement inhibitors. It was a C3 inhibitor, Pegcetacoplan, and they looked at basically the kind of a post hoc analysis of the hemoglobin concentration of patients who received Pegcetacoplan compared to those who received Eculizumab from the two trials, the Pegasus trial and the Prince trial. These were randomized controlled trials, and basically the presenter talked about how hemoglobin concentration improves with Pegcetacoplan study. So that was, an interesting point, although, it's not entirely sure how Pegcetacoplan will help in the other side effects, the other sort of effects of PNH, or whether it's just limited to hemoglobin or not. So that was the PNH side of things. Then we had a really interesting study from Malaysia, and in that the doctor basically presented their phenotype-genotype correlation in hemoglobin H disease. And very interesting data that came out was, firstly, how prevalent the non-deletional alpha thalassemia is in Malaysia, which is something which probably wasn't known as much before, and how much more severe non-deletional thalassemia is, alpha thalassemia is, or non-deletional alpha thalassemia causing HPH is compared to the deletional ones, and clearly some, effects on how to counsel patients, etc., based on that as well. So that was a very, very good, very large number of patient cohort study, multi-center sort of registry study. And then finally two sickle cell, so there was a really interesting sickle cell study, not two sickle cells, just one sickle cell study, sorry, and that was really the one to do with, is much closer to home. So it was done in England, and it was the first time we've really had, this was a national audit talking about how we treat pain acutely in English hospitals. And Sanne Lutgaard from Bristol presented that work, and it made quite difficult reading because despite the NICE guidelines which were published in 2012, so we've had 10 years of NICE telling us that we need to treat our patients with pain relief within 30 minutes of their presentation, but actually only 21% of patients appeared to have met that standard, or the audit standard. So that was interesting, and there were lots of data to do with where patients are being treated, whether it was in emergency department, what they were being treated with, and really just to show that there was quite a lot of heterogeneity in the way acute sickle care was being provided in the hospitals around the country. But vast majority, there was a bit of consensus on what treatment was given in adults and children, so predominantly morphine and oxycodone in adults, and morphine and intranasal diamorphine in children. So that was a good thing, actually, to say that there's some consensus on the actual treatment, but the timeliness of it and the mode of delivery. So it seems like quite a lot of service level development needs to be done in that situation. So yeah, these were the the highlights. Sorry, it's a long answer to a relatively short question, but essentially quite a lot of interesting information come from this morning's session.